Welcome to today's video about symptoms of lung cancer. Stop everything you're doing right now. In the time it takes you to watch this video, 3 people will die from lung cancer. That's 1 death every 3 minutes, faster than brewing your morning coffee. But here's what will shock you. Most of these deaths are completely preventable if you know what to look for. Before we uncover these life-saving secrets, if you're new here, welcome to our health family. We're on a mission to save lives through knowledge, and your health journey matters to us. Hit that like button if you're ready to learn something that could change everything, and subscribe because this information is too important to miss. Drop a comment telling us which country you're watching from. Knowing our global community helps us create content that saves lives worldwide. Right now, your body might be screaming a warning that you're completely ignoring. That persistent cough you've been dismissing? That slight breathlessness climbing stairs, the fatigue you blame on stress, these could be your body's desperate attempts to save your life. Lung cancer is the ultimate master of deception. It doesn't crash into your life with dramatic symptoms, it whispers through innocent-seeming signs that perfectly mimic everyday ailments. A lingering cough gets blamed on allergies. Unusual tiredness gets attributed to busy schedules. Subtle chest discomfort gets dismissed as muscle strain. Meanwhile, this silent assassin grows stronger every single day. Here's the life or death truth that changes everything. Catch lung cancer early and your survival rate soars to over 60%. Miss the early signs and that number crashes to a terrifying 6%. The difference between living and dying often comes down to recognizing 12 specific warning signals your body sends. Today, we are revealing these 12 scientifically proven symptoms that every human being must know. Some will surprise you, others might make your heart race with recognition, but all of them could be the key to catching this silent killer before it destroys everything. What you learn in the next few minutes could literally be the difference between life and death for you or someone you love.
All right, here comes the first warning sign of lung cancer. Let's dive in. Persistent cough. The most dangerous symptom of lung cancer is also the most ignored one. According to the American Cancer Society's 2023 research, up to 75% of lung cancer patients have this symptom at diagnosis, yet most people dismiss it for months or even years. This isn't your typical cold or allergy cough. Lung cancer coughs start dry and hacking, refusing to respond to cough drops, honey, or over-the-counter medications. What makes it particularly sinister is how it mimics common respiratory issues, causing people to delay seeking medical help until it's too late. The cough typically worsens at night, disrupting sleep and gradually wearing down your body's defenses. Research shows that while normal coughs resolve within 2 to 3 weeks, lung cancer coughs persist for months, sometimes coming and going to give false hope before returning with increasing intensity. This pattern of temporary improvement followed by worsening is a critical red flag that demands immediate medical attention. Next, number 2, shortness of breath. Mayo Clinic's 2023 research reveals that 60% of lung cancer patients experience this symptom, yet it's often the most misunderstood. The insidious nature lies in its gradual onset. You don't suddenly wake up unable to breathe. Instead, it develops so slowly that most people unconsciously adjust their lifestyle to accommodate it. First, you might notice breathlessness during strenuous exercise, then moderate activity, and eventually even during rest. What's happening inside is frightening. Tumors obstruct airways, while fluid accumulates around the lungs, creating a perfect storm of respiratory distress. Patients describe feeling like they're breathing through a straw or having a weight pressing down on their chest. Simple activities like walking to the mailbox or carrying groceries become exhausting endeavors. The tragedy is that people often attribute this to aging or being out of shape, never realizing they're accommodating a potentially deadly disease.
Next, number 3, chest pain. Forget the dramatic chest pain you see in movies. According to the National Cancer Institute, lung cancer-related chest pain is typically a dull, aching discomfort that's easily confused with muscle strain or heartburn. This deceptive nature makes it one of the most overlooked warning signs. The pain has distinctive characteristics. It worsens with deep breathing, coughing, or laughing. It might start as an occasional twinge, but gradually becomes constant, particularly on one side where the tumor is located. Some experience sharp, stabbing pains that come unpredictably, while others describe a constant gnawing ache that never completely disappears. The pain can radiate to the shoulder, arm, or back, mimicking arthritis or muscle injury. This occurs because lung tumors can grow large enough to press against nerves, ribs, or other chest cavity structures. As tumors grow larger or spread to nearby structures, the pain becomes severe enough to interfere with sleep and daily activities. Next, number 4, hoarseness or voice changes. Your voice changing might seem unrelated to lung problems, but according to the Journal of Thoracic Oncology, hoarseness occurs in approximately 18% of lung cancer patients. The mechanism is both fascinating and frightening. Lung tumors can compress the recurrent laryngeal nerve that controls vocal cord function, causing a hoarse, raspy, or weak voice. What makes this symptom particularly dangerous is that voice changes are often attributed to allergies, acid reflux, or overuse. Many people try home remedies or voice rest without seeking medical attention. However, lung cancer-related hoarseness has a persistent quality that doesn't respond to typical treatments. This symptom can appear months before other signs become apparent. Patients describe their voice as sounding different or not quite right, even when others might not initially notice. As tumors continue growing and exert more pressure on the nerve, hoarseness becomes more pronounced, sometimes progressing to complete voice loss.
Next, number 5, unexplained weight loss. Sudden unexplained weight loss is often initially welcomed by patients who have struggled with weight management. However, Cancer Research UK's studies show that unintentional weight loss of more than 5% of total body weight within 6 months occurs in approximately 60% of lung cancer patients. This isn't the result of improved diet or exercise. It's your body's response to cancer's metabolic demands. Cancer cells consume enormous amounts of energy, stealing nutrients from healthy tissues. Additionally, lung cancer can trigger the release of substances that alter metabolism, causing your body to burn calories at an accelerated rate even during rest. The dangerous progression happens rapidly without explanation. Patients notice clothes fitting differently, belts requiring new notches, or concerned comments from family about their appearance. This weight loss often accompanies decreased appetite and changes in taste perception, creating a dangerous cycle that rapidly deteriorates overall health. Next, number 6, fatigue. The National Comprehensive Cancer Network's research shows that cancer-related fatigue affects up to 95% of lung cancer patients. This goes far beyond normal tiredness. It's an overwhelming exhaustion that doesn't improve with rest and has several underlying causes that make it distinctly different from normal fatigue. Cancer cells divert energy resources from healthy tissues, essentially starving your body of fuel needed for normal functions. Additionally, lung cancer can cause anemia by affecting red blood cell production, reducing oxygen delivery throughout your body. This fatigue comes in unpredictable waves, with periods of relatively normal energy followed by crashes of overwhelming exhaustion. What's particularly concerning is how it affects cognitive function alongside physical energy. Patients describe brain fog or difficulty concentrating, making simple tasks like reading or following conversations feel impossibly challenging.
Next, number 7, coughing up blood. Cleveland Clinic research indicates that approximately 25% of lung cancer patients experience blood in their sputum, ranging from tiny streaks to more substantial amounts. Even the smallest amount should never be ignored or dismissed. The blood might appear as bright red streaks, rust-colored specks, or give sputum a pinkish tinge. Some patients describe coughing up small clots or notice blood-tinged saliva when they first wake up. This occurs because tumor growth affects blood vessels within the lungs, causing bleeding that mixes with respiratory secretions.
As tumors expand, they can erode through small blood vessels, while irritation and inflammation make vessel walls more fragile and prone to bleeding. The amount of blood doesn't necessarily correlate with disease severity. Even small amounts can indicate significant problems requiring immediate medical evaluation. Next, number 8. Frequent lung infections. The American Lung Association's research shows that repeated episodes of pneumonia or bronchitis can be early indicators of lung cancer, particularly when infections occur in the same lung area. Tumors obstruct airways, creating pockets where bacteria accumulate and multiply. These obstructed areas don't drain properly, making them perfect breeding grounds for infections. Additionally, damaged tissue around tumors is more susceptible to bacterial invasion, leading to frequent respiratory infections that tend to occur in the same lung region repeatedly. What makes this pattern particularly dangerous is that both patients and healthcare providers might focus on treating infections without investigating the underlying cause. Patients receive multiple antibiotics courses that provide temporary relief but don't address the tumor causing recurrent problems. This cycle can continue for months or years before the true cause is discovered.
Next, number 9. Wheezing. Research published in the Annals of Internal Medicine reveals that new-onset wheezing in adults, particularly those over 40, can be an early sign of lung cancer. The mechanism involves airway obstruction caused by tumor growth, creating narrowed passages that cause turbulent airflow, producing the characteristic whistling sound. Cancer-related wheezing often affects only one side of the chest, unlike asthma-related wheezing, which typically affects both lungs. Many adults develop respiratory issues as they age, making new wheezing seem like natural progression rather than a warning sign. Cancer-related wheezing has specific characteristics. It may be more noticeable during certain positions or activities, might not respond to typical asthma medications, and progressively worsens over time. Unlike allergic wheezing that comes and goes with trigger exposure, cancer-related wheezing becomes increasingly persistent. Next, number 10. Swelling in face or neck. According to the Journal of Clinical Oncology, facial or neck swelling, known as superior vena cava syndrome, occurs when tumors compress the large vein returning blood from the upper body to the heart. This compression creates blood backup in the upper body, causing characteristic swelling. Patients often first notice this swelling in the morning when they wake up, as lying flat overnight worsens blood flow obstruction. The swelling might initially be subtle, puffiness around the eyes or slight facial fullness, but becomes more pronounced as compression worsens. Advanced symptoms include difficulty swallowing, voice changes, or head pressure feelings. The skin might take on reddish or purplish discoloration, and neck and chest veins may become more visible as the body attempts creating alternative blood flow pathways. This symptom indicates cancer has grown quite large or is located near major blood vessels.
Next, number 11. Bone pain. MD Anderson Cancer Center research shows that bone metastases occur in approximately 30 to 40% of advanced lung cancer cases, most commonly affecting the spine, ribs, pelvis, and long bones. This represents serious disease progression, indicating cancer has spread beyond the lungs. Cancer-related bone pain is described as deep, aching, and constant, unlike arthritis pain, which tends to worsen with movement and improve with rest. The pain might start as a dull ache, but can progress to severe, incapacitating discomfort that interferes with sleep and daily activities. Bone pain from lung cancer metastases can occur anywhere in the skeleton. Spine involvement might cause back pain radiating down the legs, while rib involvement can cause chest pain worsening with breathing. Hip and leg bone involvement might cause limping or walking difficulty that progressively worsens. Next, number 12. Neurological symptoms. National Cancer Institute research indicates that brain metastases occur in approximately 20 to 25% of lung cancer patients, producing symptoms that might initially be attributed to other conditions. Neurological symptoms manifest differently depending on brain metastases location. Headaches are often the first sign, but these aren't ordinary tension headaches.
Cancer-related headaches tend to be more severe in the morning, may worsen with coughing or bending over, and don't respond well to typical headache medications. Other symptoms include seizures, balance problems, dizziness, coordination difficulties, personality changes, memory problems, or confusion. These neurological symptoms often develop gradually, making them easy to dismiss until they significantly impact daily functioning. The progression can be subtle, forgetting familiar names, difficulty finding words, or confusion moments that seem to pass quickly. Next, what medical tests to take to confirm? If you recognize any of these symptoms, especially multiple ones, knowing which medical test to request could be the difference between early detection and a late-stage diagnosis. The American College of Chest Physicians recommends a specific diagnostic pathway that has proven most effective for lung cancer detection. The first line of defense is a chest X-ray, which can reveal suspicious masses or abnormalities in lung tissue. However, chest X-rays miss approximately 25% of early-stage lung cancers, which is why additional testing is crucial for anyone with persistent symptoms. A CT scan of the chest provides much more detailed images and can detect tumors as small as a few millimeters. For high-risk individuals with symptoms, a low-dose CT scan is the gold standard screening tool. This test can identify lung nodules that are too small to show up on regular X-rays. If imaging reveals suspicious areas, a biopsy becomes necessary to confirm whether abnormal tissue is cancerous. This can be done through bronchoscopy, where a thin tube with a camera examines airways and collects tissue samples, or through needle biopsy guided by CT imaging. Additional tests might include PET scans to determine if cancer has spread, blood tests to check overall health, and pulmonary function tests to assess lung capacity. Don't hesitate to ask your doctor about these specific tests if you're experiencing concerning symptoms. These 12 symptoms reveal lung cancer's true nature as a master of disguise, hiding behind common ailments until reaching advanced stages. Each symptom represents your body's desperate attempt to communicate that something is seriously wrong. The tragedy lies not just in lung cancer's lethality, but in how often it could be caught earlier if people recognized these warning signs. Every day with undiagnosed symptoms is potentially another day cancer grows stronger and spreads further. Knowledge is power, and now you have information needed to potentially save your life. Don't let embarrassment, fear, or assumptions that symptoms will resolve prevent seeking medical attention. Healthcare providers would rather evaluate benign symptoms than miss opportunities to catch cancer in early treatable stages. Having symptoms doesn't automatically mean you have lung cancer. Many conditions cause similar signs. However, symptom combination, persistence, and progressive nature should prompt immediate medical evaluation. Trust your instincts. If something feels wrong, don't ignore it. Your life is too precious to gamble with, and your body too intelligent to ignore. Listen to what it's trying to tell you and take action accordingly. In the fight against lung cancer, knowledge and early action are your most powerful weapons. If this video was helpful, kindly type "helpful" in the comment. That motivates us to produce more content like this. Please like this video if it provided valuable information, share it with anyone who might benefit from this knowledge, and subscribe to our channel for more health-related content that could potentially save lives. Thank you for taking the time to learn about these crucial warning signs, and remember, when it comes to your health, it's always better to be safe than sorry.